Hi, we had a most enjoyable episode 5. What did we discuss? We began with a case of an asthma mimic from Miguel. And I think that made us realize that everything that wheezes and coughs is not asthma. I think what was a very important message that came across was that patients who have asthma can also have breathlessness due to other reasons. And one of them, which is very important, was vocal cord dysfunction. We also spent some time understanding how to diagnose that better in clinical practice. And we often don't have the luxury of an ENT surgeon and a laryngoscopy at the time the symptoms appear, but how we can clinically suspect it, how we could differentiate it from a patient with, say, functional dyspnea or from refractory asthma or a classical asthma episode. So differentiating vocal cord dysfunction from an asthma attack was beautifully illustrated in that case. We had great inputs from both John Hoffney and Miguel Rodriguez. We followed that up with a case, a very common case that we see on the non-acceptance of asthma as a diagnosis. And we had this young patient who had asthma, had been taking medication for asthma, not the most appropriate, but was refusing to accept that she had asthma. Miguel and John helped us beautifully in helping this patient understand why she should accept a diagnosis of asthma and why we as physicians should deliver the diagnosis of asthma in the most appropriate way. And there are some patients who just don't accept that they have asthma despite everything you try, and there are via medias to circumvent that. Also, the steroid phobia that many asthmatics have and how to overcome that with good communication skills was what was discussed. And we finally ended up with a case from John Hoffney, and that case pertained to a patient who had a diagnosis of asthma, a correct prescription, but was uncontrolled. And this is a sad reflection of our times where we have the drugs, we have them affordable in many of our countries now. We have a great prescription, but the patient doesn't take the inhaler correctly, or he takes the wrong inhaler at the wrong time by the wrong technique. All this was discussed as to how to get the right drug at the right time with the correct technique, and how it's so important that learning your inhaler is more like learning how to golf than learning how to ride a bicycle. John and Miguel really discussed these challenges that we face in primary care asthma practice, which had learning points for even people like me, who's a respiratory physician, because we see our patients much less frequently than primary care physicians do. So there were a lot of learning points. And at the end of the session, we also discussed some questions that had come in from many countries, which included queries related to cough variant asthma, what to do when patients don't respond to the inhaled steroid very well, the side effects of inhaled steroid, and of course, the challenge of getting your patient to take what you prescribe regularly and correctly. So we had a whole basket of issues and challenges that physicians face in primary care asthma management, and we hope that you will enjoy, if not already, watching this episode. Thank you very much.